studies have shown that vaccine and infection immunity wanes after about 6 months. So those who were eligible received their first booster dose back in the winter of 2021 and early 2022. So how quickly should this next round of booster shots be rolled out?
Right. So great points. I think it's important to recognize that when we talk about waning immunity, primarily that's with protection against getting the infection. And what we're seeing is that there is still very significant protection against severe disease, such as hospitalization and death. So if we're talking about what the vaccine program, like where should we really be doubling down our efforts right now? We really should be focusing on third doses too. I mean, there are so many people who are eligible who have not yet received a third dose. People, if the question in July is asked who would most benefit from a fourth dose of a vaccine, it really is people on the older end of the spectrum and people with underlying medical conditions that put them at greater risk for severe infection, especially those who have had their most recent dose, 5-6 months ago. We also have to recognize, too, there's going to be a big vaccine push in the fall. We know we're going to have a late fall or winter wave, and there's going to be a vaccine push at that time as well with updated vaccines that are likely more protective against the Omicron variant. So this is the kind of situation where we start opening up vaccines to everybody. Some people might be confused. Should I get one? Should I not get one? I think the real issue here is people should be sitting down with their healthcare provider if they have any questions or any uncertainty about this, and talk to the healthcare provider about if they're best getting a vaccine now or if it's best for them to wait until the fall.
So what are the risks or consequences if we don't have an uptick in third and fourth boosters?
Well, the key here is, especially with the third, is that you really have that significant protection against severe illness. And we have to acknowledge that while these vaccines are absolutely fantastic, they just don't provide the same degree of protection against infection as they did prior to this variant emerging. And before, we could say, you know what, this will reduce your risk of infection, this will reduce your risk of onward transmission. It still does that, but to a much, much, much lesser extent. But what's wonderful about these vaccines is they really hold up against protecting against severe illness. And we have to, I think it's important to acknowledge that, and also acknowledge that the third dose really adds a lot to second doses in terms of protecting against severe illness, and we should really be focusing our efforts on that. And I'm not ignoring the fourth dose. Like, there is a time and a place, and there's some people that should really be focusing on that as well. We just have, I think it's a more nuanced conversation. Early in the pandemic, we could say, hey, everyone go get your first dose, everyone go get your second dose. It was pretty straightforward. Now I think there's different people in different phases of vaccination, and I think the conversation is a bit more nuanced now.
Does the guidance change if you've recently had the virus or if you are one of those long COVID folks?
Well, the guidance doesn't change, but the science actually says that, if you've had an infection and recovered from infection, you can't ignore some of the protective immunity that you get from that. It absolutely helps. But when you actually look at those who have recovered from infection versus those who have recovered from infection but also have received vaccination, the people who have received vaccination seem to have more protection. So, yes, we can't ignore that immunity that you get from recovery from infection. It's just you have better protection with vaccination as well.
Dr. Bogoch, final question as we are watching the premiers meet in Victoria this week, talking about healthcare, looking for more money from the federal government. What are you watching for to address the shortages and the ER closures that we've been seeing across the country?
A sustained investment in personnel and a coordinated strategy where we don't have provinces juggling and jockeying for position and really competing against each other. It would be wonderful to have a Canada-wide approach so that provinces aren't, poaching healthcare personnel from one place to another, but we have a coordinated approach. The other thing that would be very helpful too is to ease many of the restrictions that healthcare providers face in moving or working in different provinces. I think there's significant barriers and red tape, and if that was eased, I think that could also be a very one easy fix to a much more complicated problem, but a simple solution to allow healthcare providers to work in different provinces without all that red tape.